Will the House please come to order and members kindly take their seats? Welcome back. We are returning from a recess, and this will be our last group of bills for today, and we'll adjourn after. We have 4 bills that we'll be addressing: House Bill 91, Senate Bill 126, Senate Bill 109, and we will be postponing action on House Bill 480. So again, House Bill 91, Senate Bill 126, Senate Bill 109, and House Bill 480 with a postponement. With that, member from Poultney, can you please offer us a motion to suspend rules to take up for immediate consideration, pending its entry on the notice calendar, the Committee of Conference report on House Bill 91, which is an act relating to Vermont Homeless Emergency Assistance and Responsive Transition to Housing Program?
Madam Speaker, I make a motion to suspend rules in order to take up for immediate consideration pending entry on the notice calendar, H91.
The member from Poultney moves that we suspend our rules to take up for immediate consideration pending its entry on the notice calendar, House Bill 91. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended rules to take up House Bill 91 for immediate consideration. House Bill 91 is an act relating to the Vermont Homeless Emergency Assistance and Responsive Transition to Housing Program. The bill was referred to a committee of conference on the disagreeing votes of the 2 chambers. The committee of conference has met and considered the same and recommends that the House adopt its report, which the first assistant clerk emailed to members at 12:16 today. The Committee of Conference report is also posted on the House Overview webpage, and paper copies are available at the main table. Member from Waterbury.
Thank you, Madam Speaker. So I stand here today at seat 91 to share with you the results of our conference committee report on H91. I'm a little slow this session. That didn't occur to me until about 3 weeks ago. So the first thing that I would like to do, Madam Speaker, is to thank the immense contributions of all of our community partners throughout the dialogue that we have had on this bill. Your House Human Services Committee took very seriously the charge at the beginning of the session to improve the services and supports, the accountability, and the integration of services for people who are homeless, and to do so at a cost that the state could afford. And so we come to you today to replace the existing program that's become known as the Hotel Motel program. We come to you with the creation of an integrated, community-based program for people who are homeless that focuses primarily on prevention services, focuses on reducing the number of people who are homeless, and focuses on the creativity that we know exists in our local communities. The creativity that will help us make real change for people who are homeless, for our communities, and for the state as a whole. This bill left the House on April 1st. We held a conference committee yesterday. We had 2 meetings, and the full conference committee agreed on the report that I'm about to present. Most of the bill, I want to say, is what left the House. The major components of the bill are what we voted on favorably in the House back on the first day of April. So I will highlight the changes that have been made in the bill since then. The first change is in the findings section, section 1. We have updated because unfortunately we have more up-to-date information about the number of people who are homeless in our system and in our state. And according to the Vermont Homeless Management Information System, as of March 2025, 4,971 individuals who were homeless in the state, are homeless in the state. 1,105 of them are children. Nearly 5,000 people in the state are homeless, and 1,100 of them are children. That's the most recent data. We are clear in the legislative intent section that, and this phrase appears several times in the bill. So it not only appears in what we refer to as session law, but it also appears in what will appear in the Green Books, that Vermont intends to reduce its reliance on the inefficient use of hotel and motel rooms and to really expand the use of shelters throughout the state, as well as more preventative services. I know that some of you have heard from your local shelter providers during this process, and one of the things that we want to assure members of is that the existing shelters are extremely integral to the process of trying to solve our problem of homelessness. I think that there is some fear about a changing system, understandable, because change does create some uneasiness for all of us. So in recognition of that, there is a section that identifies in fiscal years 27 and 28, emergency shelter services funded through what is currently known as the Housing Opportunity Grant Program would be funded at a level that's equivalent to or greater than their FY25 allocations. So that is an effort to try to assist shelter providers in transitioning to this new system without being fearful of what I think that some of them are in terms of decreased resources. Again, that is not any increase at this particular point in time. The bill does not promise them any increases, but that is already within the base budget and the budget that the governor signed a few days ago. In the definitions section, we modified the at-risk of homelessness definition to say it means precariously housed without sufficient income, resources, or support to prevent homelessness. Again, we are trying to closely align to the federal HUD definitions, and likewise, we did something similar for what homeless means, and it means lacking a fixed, regular, and adequate nighttime residence, facing imminent loss of primary nighttime residence, fleeing or attempting to flee domestic violence, or otherwise defined as homeless under federal law. So I think that's something we wanted to make sure that we were in lockstep with what HUD definitions mean and are generally understood in the community. Household. I know there has been a lot of discussion among folks at various times during the last 5 or so years about the people who individuals believe are flocking to Vermont for our services. This bill makes it clear that this is intended for people who are residents of Vermont. It's very clear about that, who live here and who intend to stay here, as evidenced by their intent to dwell in the state. That language has been strengthened in this bill as a result of the conference process. One of the things that changed from the House bill, we had a statewide committee that advised on implementation, and the Senate felt that regional advisory councils, regional to each of the 5 community action agencies, would be a better use and allow more input at the regional level. And so we concurred with that Senate change, and so there are regional advisory councils created in this bill, and their membership shall include individuals with lived experience of homelessness, local housing coalitions, or a continuum of care serving as a local housing coalition, other organizations providing services in the region, municipalities. You see, municipalities are definitely recognized here, and the impact on municipalities is recognized in this bill. Statewide homelessness organizations and the field services director in those regions, and any other representatives of the Agency of Human Services as deemed, excuse me, necessary. And then there are also additional members that the Community Action Agency may consult with, and they are the usual folks who you would expect and are similar to what the House had in the bill. Just to refresh members' memories, because I'm going to refer to this momentarily, but in VHARTH, which is how it will be referred to now, the department will enter into an agreement with each community action agency and with the statewide organization providing services to individuals who are impacted by domestic violence. And then each community action agency or the network, in collaboration with other community partners. I think that's a really key thing about this bill. The following services are required core services. So they include intake and assessment, services for diverting from homelessness. We talk about the creation of regional intake shelters within this, a needs assessment for each household, individualized plans for each household to address identified needs, housing navigation services, assistance obtaining and retaining housing, including financial assistance, landlord-tenant outreach, education and conflict resolution, and then navigation to other services such as mental health support, peer-supported services, job training and employment services, other services related to disability or someone's age, referral to healthcare assistance. All of those are part of the core services that will be required in each community. And then additionally, monitoring the progress of the individual towards achieving their housing plan. I want to get to the use of hotel and motel rooms. As is stated several times throughout the bill, it's the intent of the General Assembly to decrease reliance on hotel and motel rooms for emergency housing. However, we know that we do not have sufficient capacity within our shelter system right now at about 680 beds or so to house the number of people who are homeless. We do expect to have to use on a more limited basis, but on a very prescriptive basis, how hotels and motels might be used. Also, there is provisions that annually, as shelter capacity increases and the number of households experiencing homelessness decreases in each region of the state, the use of hotel and motel rooms for emergency housing shall decrease, not may decrease, shall decrease. And then annually, as part of the Department for Children and Families budget presentation, the department shall set goals for increasing the housing capacity, including supportive housing and shelter beds, some of which may be population specific. So for folks who have potentially mental health needs or people who might have significant health issues, they will be able to be addressed. If a hotel or motel is being utilized, a community action agency must assure that they have, one, a contract with that hotel or motel that lays out essentially how those rooms would be used. And I want to say that essentially what we'd be expecting and what it says in the bill is that if a person is in a hotel, that they must be provided with the core services. So it's no longer going to be here, here is your, they call it a benefit, here is your voucher for a hotel, and you go to the hotel and that's it, essentially. We have long known that people need an integrated service plan in order to make any real change in their situation. And so that requiring a case manager, requiring the services, part of the core services as applicable to each person is required in the bill. There is another provision that the House added back in its proposal that community action agencies or other providers shall not utilize hotels and motels outside the community action agency's region. unless approved by the department or in a written memorandum of understanding between the community action agencies. This is to deal with the issue that municipalities have brought forth, saying that they feel and they believe that people are being moved around wherever there is a hotel bed, essentially, and that could be miles and miles away from where the person actually lives and where their support system may be. So this benefits the individuals and it benefits the municipalities. This does require the Department for Children and Families to adopt rules, and the rules will outline the standards for community action agencies and other providers that they will have to meet in order to continue to provide services. And there are a number of progress reports that the Senate felt was necessary to assure that this is going to essentially be ready for implementation on July 1 of next year. So there is a progress report on October 1st, which is the first of 2 written progress reports. Many of the things that are contained in the progress reports were things that we had already outlined for the implementation committee in the House bill. There's another progress report on January 15th. There's a progress report. Hold on a second. I think I missed one. January 15th. July. The progress report in January will need to outline the appropriations that are expected to be needed for the full implementation of the program. And it will identify things like the appropriate intake and assessment processes. The bill does now require verification of residency, homelessness, and household income. On or before January 15th of 2026, the community action agencies will be submitting a comprehensive progress report that will then be also submitted to the legislature, and then again on April 1st, 2026. Section 7 of the bill, which are updates to the statute that governs community action agencies generally, did not see any changes. That was just essentially to make updates to language that we had done previously in the House bill, and that saw no changes. Section 8 is the appropriation section. I do want to stress that the money for this bill is already in the budget that has been approved by both bodies and has already been signed by the governor. However, that being said, and in that budget, there was $10 million appropriated. However, in this bill, we are reducing that to $7 million for the transition expenses associated in FY26. $5,085,000 of that will go to the Department for Children and Families for their distribution to the community action agencies and for other planning purposes that they may need within the department. $400,000 will go to DCF for distribution to the network serving individuals impacted by domestic violence. $515,000 will go to the Department of Health for distribution to a program called Bridges to Health for services to individuals who are experiencing homelessness or at risk of homelessness that program serves. And $1 million will go to DCF for distribution directly to municipalities. This is something that I think any of us who represent a community where there has been a large number of individuals placed in hotels recognize the impact on local communities who have been home to these hotels and motels that have been used. So there is $1 million here to distribute to local communities who have experienced those additional costs. During the transition, one of the things that was important to the administration was to be able to implement elements of this prior to July 1 of 26 if parties agree and they were able to come to agreement that there were certain things. So I'm fairly positive that the agreement with the Vermont Network Against Domestic Violence will happen prior to July 1, 26, based upon reports from the department. And there are potentially elements of this bill and of VHARTH that may be implemented prior to July 1. The House version of the bill did not have that when we sent it over, but there is a provision in the conference committee report that allows that to happen prior to July 1. And Madam Speaker, I believe that that's the end of my report, and I wish to yield to the member from Rutland City.
The member from Waterbury yields to the member from Rutland City.
Thank you, Madam Chair. I just want to take this opportunity to express my gratitude and appreciation to the committee of conference for the work that was put on into it, as it's already been stated by Madam Chair Wood. The a lot of time, effort was put into this bill. A lot of great changes were made, the verification pieces, as well as guardrails, as well as requirements and obligations that have been now placed upon the participant within these programs. I think it has a great benefit of reducing unilateral and collateral cost on the system over time. It will reduce our need to utilize hotel and motel programs. I believe as we continue to expand our shelter program and continue to get the necessary services out to the individuals in needs, as well as expand the rest of our infrastructure of continuum of care, whether it's nursing homes, recovery houses, you name it. This bill really has the potential to have a significant impact upon the vulnerable population in our state. I do support this bill, and I hope this body will also. Thank you.
The question is, shall the House adopt the report of the Committee of Conference on its part? Member from Bridport.
Thank you, Madam Speaker. Today I rise not only as a legislator, but as someone who knows professionally and personally what it means to experience housing insecurity and homelessness in Vermont. I stand before you because I have lived through the realities that so many Vermonters are facing right now. The fear, the uncertainty, the exhaustion of not knowing where you'll sleep next, and the immense challenge of climbing towards stability when the very ground beneath you is uncertain. I also rise as someone who has worked for years within our affordable housing and homelessness response systems. I walked alongside people struggling to find shelter, to access services, to hold their lives together while falling through the cracks of systems that weren't designed for them. I have seen and experienced firsthand how compassion paired with coordination can transform lives. And I've also seen how outdated, fragmented systems can trap people in cycles of harm and despair. H91 is our opportunity to change that. This bill is not just a policy document, it is a blueprint for more humane, effective, and equitable response to homelessness in Vermont. It is built on clear, sobering data. Vermont now has the 4th highest rate of homelessness in this country. Over 4,900 Vermonters, 1,100 of them children, were experiencing homelessness as of March of this year. We cannot ignore this. H91 delivers a vision and a humane path out of our dependency on hotels. It replaces a patchwork of emergency housing services with VHARTH, an integrated, coordinated system rooted in trauma-informed care and a deep respect for regional planning and lived experience. This bill invests in permanent solutions, not just temporary options often devoid of services. This bill transitions away from the unstable system of reliance on hotel rooms that leaves unhoused Vermonters in a constant, harmful state of uncertainty while expanding access to a robust menu of services and community-based shelter options. And this bill mandates accountability, transparency, and regional equity in service delivery. And above all, it reflects what we know to be true, that when our neighbors experience homelessness, it must be rare, brief, and non-reoccurring. This bill is a compromise shaped in good faith and with bipartisan support by the House and Senate. It is strong, it is comprehensive, and it is deeply needed. Passing H91 means we acknowledge the human dignity of every person without a home. It means we believe Vermont can do better, must do better, and will do better. It means that instead of responding in crisis, we will respond with care, strategy, and commitment. So today, I ask you, vote yes, not just for this bill, but for Vermonters who are waiting for us to act. Let us move forward together with compassion, with courage, and with conviction. And Madam Speaker, I ask that when the vote is taken, it be taken by roll.
The member from Bridport requests that when the vote is taken, it be taken by roll. Is the member sustained? The member is sustained. When the vote is taken, it will be taken by roll. The question is, shall the House adopt the report of the Committee of Conference on its part? Are you ready for the question? Member from St. Johnsbury.
May I ask a question of the presenter?
The member from Waterbury is interrogated.
Madam Speaker, I was just wondering why the word resident is used instead of domicile, that they domicile in Vermont, not just resident.
I'm just going to make sure Madam Speaker, I'm going to make sure that I find that exact language. First off, I want to inform the members that there is case law and Supreme Court decision about what residency means. And so this is very carefully crafted by legislative counsel. So people who are the household, meaning any individual and dependents for whom the individual is legally responsible and who are domiciled and intend to stay in Vermont as evidenced by their intent to dwell in Vermont. And then it goes on. So this was something very carefully crafted by legislative counsel after reviewing the existing laws about residency.
Well, I just know you can only domicile in one place where you can have multiple residencies. So I just feel like it would have been a better word to use domicile than we know they're in Vermont.
Thank you.
Is the member done with the interrogation?
I'm all done. Thank you.
Member from Georgia.
Thank you, Madam Speaker. May I also interrogate the reporter of the conference report?
The member from Waterbury is interrogated.
Member, thank you for your report and for all the hard work on conference committee. And I ask for your patience. Some of these questions that I have, you may have answered already, but the report went by quickly and I was trying to read the fiscal impact report too at the same time. So I'm concerned about the sustainability of this program, $7 million right off the bat, and then sustaining it on into future years. First of all, do I have the correct number of Vermonters that we are intending to serve here? 5,000 people altogether, and of that 5,000, 1,000 are school children. Is that right?
Madam Speaker, yes, I quoted the number from the Vermont Homeless Management Information System that as of March 2025, 4,971 individuals were homeless and 1,105 children were homeless as of March 2025.
Okay, thank you. That that number, both those numbers are disturbing. They're actually about twice what I have been told every other time I've asked about it. Not you, not the member, Madam Speaker, but anyway, the number of people we're treating here is considerably higher than previous information I had. And now about paying for it, did I understand that we had 10 million in the budget, but this program is set up, ready to run with 7 million? Is that correct, member?
The $10 million that's been approved in the budget is one-time resources for the transition and implementation planning. The community action agencies and other community providers will need to take a intense amount of work to be ready to take over this program, these programs, as of July 1 of next year. It's a massive undertaking that for many of them will really be a very significant undertaking. So they will need to be hiring staff, they'll need to be updating computer systems, they'll need to be acquiring rental space and things like that. So that $7 million is only for implementation planning. I will refer you to a fiscal note that is on the JFO website that outlines what is included in the governor's, actually it doesn't say what is in the governor's base budget for 26. It references the 25 budgeted, but the 26 budgeted is actually lower than the 25.
Okay, I'll
So
look
there's-
that,
whoops.
I'll look that up.
Okay.
And member, about next year, do you mean the next fiscal year, which starts July 1st, 25, or do you mean next calendar year, which is more than one fiscal year from now?
I mean the fiscal year that starts July 1, 26.
Okay. Okay, that's very helpful. Thank you, Madam Speaker, and I plan to vote yes.
The question is, shall the House adopt the report of the Committee of Conference on its part? Are you ready for the question? If so, will the clerk please call the roll?
Arsenault of Williston.
2 minutes. Will the House please come to order and members kindly take their seats? Would the House please come to order? I would like to remind members that we are in the middle of a roll call vote. Members and guests are prohibited from using computers, phones, or any type of an electronic device. Please refrain from the passing of notes and conversation during a roll call. And when the clerk calls your name, please answer in a loud and clear voice so the clerk can accurately record your votes. The question is, shall the House adopt the report of the Committee of Conference on its part? Will the clerk please continue to call the roll?
Austin of Colchester. Bailey of Hyde Park. Bartholomew of Heartland. Bartley of Fairfax. Rebecca of Winooski. Byron of Virgins. Bishop of Colchester. Black of Essex. Bloomley of Burlington. Boslin of Westminster. Bosch of Clarendon. Boonaberry City. Boyden of Cambridge. Brady of Williston. Brannigan of Georgia. Brown of Richmond. Burdett of West Rutland. Burke of Brattleboro. Burkhart of South Burlington. Burrows of West Windsor. Byrd of Cabot. Campbell St. Johnsbury. Canfield Fairhaven. Carrie Stunken of Whitingham. Casey of Montpelier. Casey Hubbardton. Chapin of East Montpelier. Charlton of Chester. Christie of Hartford. Chena of Burlington. Coffin of Cavendish. Cole of Hartford. Conlon of Cornwall. Cooper of Pownell. Corcoran of Bennington. Cordes of Bristol. Critchlow of Colchester. DeMar of Venusburg. Dickinson of St. Albans Town. Dobrovich of Williamstown. Dodge of Essex. Dolan of Essex Junction. Dolgan of St. Johnsbury. Donahue of Northfield. Duke of Burlington. Durfee of Shaftesbury. Eastis of Guilford. Emmis of Springfield. Feltus of Linden. Galfetti of Berrytown. Garifano of Essex. Goldman of Rockingham. Goodnow of Brattleboro. Ghostland of Northfield. Granting of Jericho. Greer of Bennington. Gregoire of Fairfield. Pingo of Berkshire. Harpo of Glover. Harrison of Chittenden. Harvey of Castleton. Hedrick of Burlington. Higley of Lowell. Holcomb of Norwich. Hooper of Randolph. Hooper of Burlington. Houghton of Essex Junction. Howard of Rutland City. Holland of Rutland Town. Hunter of Manchester. James of Manchester. Kosinska of Burke. Keyser of Rutland City. Kimball Woodstock. Klepner of Burlington. Kornheiser of Brattleboro. Kresnow South Burlington. Labor Morgan. Lally of Shelburne. Malone of South Burlington. Lamont of Morristown. LaRoche of Franklin. Lipsky of Stowe. Logan of Burlington. Long of Newfane. Luno of St. Albans City. McGuire of Rutland City. Malay of Pittsford. Marcotte of Coventry. Maslin of Thetford. McCann of Montpelier. McCoy of Pulteney. McFawn of Berrytown. McGill of Bridport. McLiss of Milton. Mahaly of Calais. Minier of South Burlington. Morganella Milton. Morgan Emma Milton. Morse of Springfield. Morrissey of Bennington. Morrow of Weston. Rowicki of Putney. Nelson of Derby. Nielsen of Brandon. Niagara of Bennington. North of Ferrisburg. Noyes of Woket. Nugent of South Burlington. O'Brien of Tunbridge. Odie of Burlington. Oliver of Sheldon. Olson of Starksboro. Page of Newport City. Parsons of Newberry. Pezzo of Colchester. Pincinel of Dorset. Pouch of Heinsberg. Powers of Waterford. Priestley of Bradford. Pritchard of Pollitt. Quimby of Linden. Rachelson of Burlington. Sekowitz of Randolph. Shai of Middlebury. Sheldon of Middlebury. Sibylla of Dover. Southworth of Walden. Squirrel of Underhill. Steady of Milton. Stevens of Waterbury. Stone of Burlington. Supernut of Barnard. Sweeney of Shelburne. Taglavia Corinth. Taylor Milton. Tomlinson Winooski. Tufa Sandwinstown. Torrey Moortown. Walker Swanton. Wazzazaka Berry City. Waters Evans of Charlotte. Wells of Brownington. White of Waitsfield. White of Bethel. Winter of Ludlow. Wood of Waterbury. Yakavoni of Morristown. Bartholomew of Heartland. Bartley of Fairfax. Boyden of Cambridge. Campbell St. Johnsbury. Casey of Hubbardton. Chena of Burlington. Donahue of Northfield. Feltus of Linden. Higley of Lowell. Malay of Pittsford. McKenna of Montpelier. O'Brien of Tunbridge. Parsons of Newberry. Supernut of Barnard. Wells of Brownington. And White of Bethel.
For purpose of explanation, member from Burlington.
Madam Speaker, I cast my vote with gratitude for the leadership and persistence of the Human Services Committee, for the willingness of community action agencies and shelter providers to step up to this responsibility, and for Brenda Siegel's tireless advocacy, which has done much to inspire this change.
Member from Westminster.
Thank you, Madam Speaker. I am glad to support H91, transitioning Vermont from reliance on an inadequate hotel-motel program to a model that will more effectively help Vermonters and Vermont communities. I have worked closely with individuals lacking stable housing and am hopeful this legislation will move Vermont forward towards addressing root issues and finding housing for all.
Member from Whitingham.
Thank you, Madam Speaker. I voted for H91 because our economy right now is precarious. And any one of us could find ourselves falling into homelessness. I'm sorry, I apologize. I'm very emotional right now. This could happen to any one of us. If you or a loved one happens to get sick, it could be the end of stable housing. When I first moved back to Vermont, it took me 10 months to find a house. It was the generosity of my loved ones and people around me lending a hand that made it possible for me to have a roof over my head during that time. I know personally the stress that is caused by not having a stable roof over your home, over your head. A home base is critically important. We have the opportunity to transform our housing system, to build something with wraparound services that can support people who need them. Our winters are cold, and no one deserves to be left out in the snow.
Member from Essex.
Madam Speaker, I am proud to vote yes for H91. H91 is a transformative piece of legislation that integrates Vermont's homeless assistance system. It creates a person-centered program that will provide essential supportive services to vulnerable Vermonters who are experiencing homelessness, and it will reduce our reliance on the ineffective hotel-motel voucher program.
Member from Berkshire.
Madam Speaker, I was hopeful that this Committee of Conference report would present us with a viable and sustainable path forward to shelter our most vulnerable populations, but I'm not convinced that the underlying causes of homelessness will be addressed and alleviated.
Member from Rutland City. Okay, member from Milton.
I began the program for housing the homeless. I was one of the first 2 employees in 2014. I do not believe VHearth is the answer. I have few concerns on H91. However, I will only mention 2. There is no longer an 80-day cap for the hotel-motel program. I believe a cap should remain with a provision to extend if eligible recipients are deemed disabled or has a medical issue. If there's no cap and there is an emergency need for a room, will there be a room available? Probably not. The startup funds will be used for additional staffing and rentals to implement VHearth. Who will pay these salaries and rentals in the future when that money runs out? I do not feel this costly bill is the fit to help our homeless population.
Member from Berry City.
Madam Speaker, housing is a human right. And until we realize that through a whole of government approach, people will continue to needlessly suffer. I support this bill for all those whom this bill will help and remind us all that the work is far from over. There are 1,100 kids counting on us.
Member from Derby.
Madam Speaker, may I explain my vote?
You may.
I voted no, but if we further remove the barriers to create an affordable housing and use public dollars to create shelter for long-lasting housing, we could better take care of these families.
Member from Morristown.
Madam Speaker, may I explain my vote?
You may.
Thank you. The 5,000 Vermonters, 1,100 of which named to be children, are only the people we have documented and accounted for through use of services. Given the current state of events, our housing crisis will get worse before it gets better. I am grateful for the work of the committee and the advocates for this step in the right direction. Housing is a human right. Let's get to work.
Members, please list member from West Windsor.
Madam Speaker, may I explain my vote?
You may.
Thank you. The idea of preventing people from falling below the impossible to overcome line of no home comes as a great relief to me, and the thought and care that's gone into this bill is deeply appreciated. Thank you.
Members, please listen to the results of your vote. Those voting yes, 92. Those voting no, 42. The ayes have it, and the report of the Committee of Conference is adopted. Member from Poultney, can you please offer us a motion to suspend our rules to take up from the notice calendar for immediate consideration the Committee of Conference report on Senate Bill 126, which is an act relating to health care payment and delivery reform?
Madam Speaker, I make a motion to suspend rules in order to take up off the notice calendar for immediate consideration S-126 in order to hear the Committee of Conference report.
The member from Poultney moves that we suspend rules to take up from the notice calendar for immediate consideration Senate Bill 126. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended rules to take up Senate Bill 126 for immediate consideration. Senate Bill 126 is an act relating to healthcare payment and delivery system reform. The bill was referred to a committee of conference on the disagreeing votes of the two chambers. The committee of conference has met and considered the same and recommends that the House adopt its report, which is printed in today's calendar. Member from Essex.
Thank you, Madam Speaker. I'm pleased to bring you the Committee of Conference report on S-126, which is an act relating to health payment and delivery system reform. Representatives from your House Health Care Committee met many times this week with committee members from Senate Health and Welfare, and were able to work collaboratively together to come to the consensus that you have before you. As you may recall, the multiple pieces of this bill provide a roadmap in order to create a more accessible, sustainable, and affordable system of care. Despite Vermont having the highest commercial premiums in the entire United States, our only domiciled commercial insurance company is facing insolvency. 9 of our 14 hospitals are in the red. Quality is declining, and access to care is decreasing. Vermonters are spending more and getting less, and Vermonters deserve better. This bill establishes reference-based pricing, which will allow us to reallocate resources in order to actually pay for the services at the cost of care for those actual services, rather than what we do now, which is providing high reimbursed services in order to subsidize the loss of revenue from the often necessary, lower cost, and high quality services that our communities actually need. This bill helps our regulators set hospital budgets and gives them the tools to enforce them. This bill allows our regulator to review the budgets of hospital networks. It provides transparency for our state agencies to see contracts between providers and payers. And it allows the Green Mountain Care Board, the Department of Financial Regulation, and the Agency of Human Services all to work collaboratively together. It creates a statewide health resource plan to inform the work of reference-based pricing, the hospital budgeting process, and to identify what resources we actually have and what resources are actually needed and where. It relies heavily on cooperation between AHS, Green Mountain Care Board, DFR, and the statewide steering committee formed in this bill. It forms a primary care committee that actually has some teeth in the development of the state plan. It holds AHS accountable for the work required and the timeline required in Act 167 around hospital sustainability. It incentivizes hospitals to come up with their own solutions. It imagines a statewide electronic health record that actually has clinical benefits rather than just data and reporting requirements. Most of all, the bill continues to be about urgency and accountability. The differences between the House and Senate versions were mostly negligible. There were just slight changes in language and clarifying words. We worked with AHS to align the dates on several of the reports so that they could report on all of the things we were looking for at the same time in one report, and decreasing any additional administrative burdens on our Agency of Human Services. We also slightly changed the members of the statewide healthcare delivery advisory committee. Some were moved to a consultative role. There were 3 main areas of concern. The bill as passed by the Senate originally contained hospital global budgets being established after reference-based pricing was fully in effect. The House had removed references to global hospital budgets because if Vermont moves ahead with the AHEAD model with the Center for Medicare and Medicaid Services, this already includes an all-payer system of global hospital budgets. The House felt it may be duplicative, and if the Green Mountain Care Board were to move ahead with global hospital budgets in this bill, it would only affect a small percentage of the commercial market. Medicaid already is rolling out global hospital budgets to hospitals. That's currently happening. After reconsideration in conference committee, we agree with the Senate position that it should be added back to S126. Due to the unknown of whether we actually are moving ahead with AHEAD, this change is and then the changes around hospital global budgets are reflected throughout the bill. And the Green Mountain Care Board, once reference-based pricing is established, will move towards establishing those budgets. This allows time to right-size our system of care using reference-based pricing, and it will provide stable and consistent revenue for hospitals. And it will also provide predictability for health insurers. I talked about how in the world of healthcare economics, payments for services are rarely based on the value of that particular service. It's always about maximizing the revenue from high-cost services in order to subsidize under-reimbursed services. Global budgets will allow hospitals to provide the care that Vermonters need without worrying about whether or not it's a loss leader. Global budgets will be established for one or more hospitals starting in 2028, and it will be completed for all hospitals by 2030. Another area of concern was around the formation of the Primary Care Steering Committee. This had been a House addition. Over half of our healthcare in the state of Vermont is delivered by primary care, and yet they only receive approximately 5% of the total healthcare spend. The House felt that it was vital that if we are to create a more equitable, sustainable, and affordable healthcare system, primary care needed a larger seat at the table. The Senate felt it might be duplicative of other advisory committees already established through the Blueprint for Health and the Green Mountain Care Board. After expressing our deep concerns that primary care not just be in an advisory role, but rather in a collaborative role, the Senate relented and we were able to keep the steering committee. However, they added Vermont to the title of the steering committee. Lastly, in Section 10, the integration of healthcare data, the Senate felt strongly that we should support the efforts that AHS is currently undertaking to align clinical and claims data to develop a unified health data space. This is work that is already ongoing. They wished it to be codified. The House felt that AHS should report back on the value to providers and our system of care before proceeding further. And in the end, we authorized them to proceed, but we asked them to report back to us on their efforts by January of 2026. After many hours, we landed on what you have before you. I personally feel that the bill ended up in a stronger place, and it maintains the purpose. This is a bill that reforms how we pay for healthcare in the state of Vermont. We can no longer ignore the crisis that we are in. I heard it just this morning, sitting in Senate Health and Welfare, from a witness. For years, we knew that the system was in danger of breaking. It is now broken. This bill is about picking up the pieces and repairing what we have and moving forward. Vermonters deserve a high-quality, accessible system of care that they can afford, and we owe it to them. The Committee on Conference unanimously approved this report, and we urge the body's support.
The question is, shall the House adopt the report of the Committee of Conference on its part? Are you ready for the question? Member from Burlington.
Madam Speaker, may I inquire of the presenter of the report from the Committee of Conference?
The member from Essex is interrogated.
Madam Speaker, why were a member of the Health Equity Advisory Commission and a representative for Vermont's free clinic programs shifted to a consulting role rather than having a vote on the Healthcare Delivery Advisory Committee?
When the bill originally came over from the Senate, I believe it contained 15 or 13. I'm trying to think of the original. It was either 13 or 15 members. The House added the additional members up to 19. And the Senate during conference committee requested that we remove 4 back to their original. And in their proposal, we proposed that we add 2 back in and that the rest be added to advisory committee. Oftentimes, when these steering committees become too large, it's very difficult to have a quorum, and they didn't want it to be too large. They also added some people to the consultative, if I recall, I think it was physical therapists have also been added. That is what happened.
I thank the member. Madam Speaker, we have serious concerns that when the voices of those who have been historically excluded from decision-making on healthcare matters continue to be excluded, then we run the risk of perpetuating injustice in our healthcare system as we redesign it.
The question is, shall the House adopt the report of the Committee of Conference on its part? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. Nay. The ayes appear to have it. The ayes do have it, and you have adopted the report of the Committee of Conference. Member from Poultney, can you please offer us a motion to suspend our rules to message our action on Senate Bill 126 to the Senate forthwith?
Madam Speaker, I make a motion to suspend our rules in order to message our actions on S-126 to the Senate forthwith.
The member from Poultney moves that we suspend our rules to message our action on Senate Bill 126 to the Senate forthwith. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended rules to message our action on Senate Bill 126 to the Senate forthwith. Member from Poultney, can you please offer us a motion to suspend our rules to take up for immediate consideration pending its entry on the notice calendar, the Senate proposal of amendment to the House proposal of amendment on Senate Bill 109, which is an act relating to miscellaneous judiciary procedures?
Madam Speaker, I make a motion to suspend rules in order to take up S-109 for immediate consideration pending its entry on the notice calendar.
The member from Poultney moves that we suspend rules to take up for immediate consideration pending its entry on the notice calendar, Senate Bill 109. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended rules to take up Senate Bill 109 for immediate consideration. Senate Bill 109 is an act relating to miscellaneous judiciary procedures. The Senate concurred in the House proposal of amendment with a further proposal of amendment thereto, which the first assistant clerk emailed to members at 1:35 today. This Senate proposal of amendment is also posted on the House Overview webpage, and paper copies are available at the main table. Member from Burlington.
Thank you, Madam Speaker. So I'm sure everybody recalls that this bill addressed many different miscellaneous judiciary issues. I had mentioned in the original bill report that this reminded me of a Whitman sampler. So think of the Senate as taking 8 pieces of candy out of the Whitman sampler and adding a new piece. So I will briefly go over the 8 sections that have been eliminated and the 1 piece that has been added. So basically, the first change appears in section 24. For those of you looking at the document that was mailed out at 1:30, it is on page 17. This section is the Firearm Surrender Order Compliance Working Group. And you'll recall that there was a lengthy list of members of this working group that the Senate had added. In the House's wisdom, we took a few members, we took 2 members off of that and added them to the group to be consulted with. The Senate came back and changed it to adding those 2 members back in. So the Center for Crime Victim Services and the Network Against Domestic Violence were moved from consultation back to members of the working group. That's change number 1. Change number 2 is on page 22 in section 27. One of the original, so that section originally was removing the sunset in the marriage fees. The good news is that was in the big bill. The governor has already signed it, and so the Senate removed it because it's already law. So let me move on to the third change, which is section 29, and that is also on page 22. So this is the appeals of revocation of bail, and the Senate's rationale was basically, I should say this because this will come up a few times, the Senate morning committees ended earlier, and they did not have time to take testimony on this piece. This basically gave, let me just remind people, in case you didn't keep it this provided that a prosecutor may appeal a court order to revoke bail using the same process that applies when the prosecutor appeals a release without bail or conditions of release. The appeal is taken to a single justice of the Supreme Court who may hear it alone or refer it to the entire Supreme Court for a hearing. The order must be affirmed if it is supported by the evidence in the proceedings. If it is not supported, the Supreme Court or single justice hearing the matter may remand the case for further hearing or may, with or without additional evidence, modify or vacate the order. So this is permitted now, but the reason that the House put the section in was for clarity and making sure that this was well known. As I said, this was taken out because the Senate committee felt that it was permitted under current law and the lack of time to take a hearing. Moving along, we're now on section 32, which is the fourth change, and this is the section on adult and voluntary guardianship. So this was requested, and the House added this, by the Vermont probate judges, creating an adult involuntary guardianship working group to study jurisdiction of proceedings involving the involuntary guardianship of adults. Under the current law, you'll remember, the probate division of the Superior Court has jurisdiction over adult guardianships unless the adult has a developmental disability, in which case the family division has jurisdiction. The proceedings have some differences, such as the ability to have a voluntary guardianship in the probate division, but not in the family division. So the House added language that the working group would have been charged with studying and recommending whether the two types of proceedings should be consolidated in one court or whether the statute should be amended to provide equal access to voluntary guardianships in both courts. The Senate felt that that they didn't have time to take the testimony they needed, and they felt the parties could have this discussion without legislation. Our fifth change, as you can see, we're getting through them, is on page 33 and is section 44. So that section, as a reminder, if you all didn't memorize them, is I'm sorry, it's, I'm sorry. Page 5, So this was related to the side judges and them having a chance to look at some of the changes that were being made in the assistant judges. So basically, Section 33 and 34 related to the process when assistant judges request capital funds for county courthouses. Under the current law, any county requesting capital funds for its courthouse must submit a request to the court administrator. Then the court administrator is required to evaluate the request based on several statutory criteria, such as whether it relates to an emergency, whether there is a state-owned courthouse in the county that could absorb the activities, etc. So the section was not to become effective until July 2nd, 2026, so that the assistant judges would have time to adapt to the new requirements. In the meantime, Section 34 required the court administrator and a representative of the Association of County Judges to jointly report to the House Committee on Corrections and Institutions and the Senate Committee on Institutions on the progress made to implement the new requirements. So when we had our bill walk through today on these changes, we had a chance to hear from the chair of the House Corrections Committee, and given that this language was struck, the House Committee on Corrections and Institutions plans to send a letter letting folks know what the intent of the bill was, because the Senate felt that this could be done without legislation and they didn't have time to take testimony. So Section 35 is our next change. And that one concerned the criminal penalties for a second or subsequent DUI offense. So they did not change the change the House made, which was basically people could go, the way the law is now, people would have a choice of 200 community service hours or 60 consecutive hours of incarceration. That's like the minimum penalty. And Section 35, the House changed the language to reduce the minimum amount from 200 hours to 80 hours. The last part of it, which is the part that the Senate has taken out, is having this reduction sunset in 3 years on July 1st, 2028, so that its effectiveness can be determined before the legislature decides whether to retain it. So the Senate took that part out, saying that we always have the right to evaluate if things are working, but the 80-hour reduction stays in place. The next change is Section 37, which was the section that was requested. The Section 37, the House language was, we request the Chief Superior Judge, the Director of the Office of Professional Regulation, and the Executive Director of the Vermont Psychological Association examine and make recommendations to the legislature regarding family forensic evaluators. These are mental health professionals who conduct evaluations and provide information regarding child welfare and parenting matters to attorneys, judges, and state agencies. We heard testimony in the House that there are not enough family forensic evaluators, so Section 37 requested recommendations from this group for increasing the numbers. The Senate said that this could happen without statute, and they didn't need that section. Section 38 was the child and legal representation section. It was to set up a child and parent legal representation task force chaired by the Chief Justice of the Vermont Supreme Court, who was very excited about this, to study the need and viability of an improved legal representation system for children and families who are involved in judicial or administrative procedures concerning CHINs, children in need of supervision, or substantiations of abuse and neglect. And that task force was to be charged with assessing and reporting on whether reform of Vermont's legal representation for children and families is necessary by exploring such topics as best practices, compliance with funding and reporting requirements in order for Vermont to leverage a lot of federal funding, and the use of an interdisciplinary model of representation, including pay scales, performance measures, supervision, evaluation processes, and recommendations of caseloads for attorneys, social workers, and other family representatives. The Senate did not have time to fully take testimony and remove that section, which was a great disappointment to many of us. So that's what was taken out. What was taken in what was added will give you a sense of deja vu, although not of this bill. But you may recall that H219, which was a really important bill that provided for the Family Support Program in the Department of Corrections to be available to families, to people in the correctional facility, regardless of their gender. The governor ended up vetoing that bill, not because he was against the policy, but because there was language in there that he felt was the legislature overstepping. So this part of the language that the Senate added is identical to H219, which our body passed. And as I said, the governor vetoed, minus the language that the governor did not like. And the governor and the Department of Corrections, according to the chair of House Institutions and Corrections, who was in our committee today, assured us that they support this language. So this the money for this has already been approved in the budget, and basically it would remove the language that makes it sound like we are assuming that there was sufficient, the need for sufficient funding. So there's $390,000 that we've approved in the appropriations bill, and it will do two things. It will make Kids Apart, the program run in the Women's Correctional Facility, whole. This program has worked really well for 20 years. It has great outcomes, and it will expand it to fathers. The first program to participate will be the Newport program, and $200,000 of the $390,000 will go towards that effort. And again, the goal of H219 was to expand it to all Vermont facilities, regardless of gender. So the straw poll in our committee was 8-1-2, and we ask for this body's support to accept the Senate's version. Thank you, Madam Speaker.
The question is, shall the House concur in the Senate proposal of amendment to the House proposal of amendment? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have concurred in the Senate proposal of amendment to the House proposal of amendment. Member from Poultney, can you please offer us a motion to suspend our rules to message our action on Senate Bill 109 to the Senate forthwith?
Madam Speaker, I make a motion to suspend rules in order to message our actions on S109 to the Senate forthwith.
You have heard the motion. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended rules to message our action on Senate Bill 109 to the Senate forthwith. Members, the final bill on our action calendar today is House Bill 480, which is an act relating to miscellaneous amendments to education law. Member from Williston.
Thank you, Madam Speaker. I request that we delay legislative action. We delay action for one legislative day on H480.
The member from Williston moves that we postpone action on House Bill 40 for one legislative day. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have postponed action on House Bill 480 for one legislative day. Members, that completes the orders of the day. Are there any announcements? Member from Bennington.
Thank you, Madam Speaker. I want to take a moment to introduce a dear friend and guest to this body. Kathy Squires McPherson joins us here today. She's from Montpelier, and she has a deep history in this building. Her father, Stanley McPherson, was the Assistant Sergeant of Arms, and so she has a very deep memory of the State House as a child. She is also a wonderful advice giver, and I've taken some of it myself, and that's saying something because I'm pretty stubborn. Please help me welcome her to the State House, and I want to say that I did ask special permission from one of the members from Montpelier to introduce his constituent, so I'm going to call dibs on that one today, but please help me welcome her.
Will the guest and member from Bennington please rise and be recognized? Are there any further announcements? Member from Derby.
Thank you, Madam Speaker. We've all worked hard this session, and especially these past few days, and we got another hard day coming. So I want to leave you with a thought. And I consider myself somewhat an expert in the field of agriculture. And yesterday, I heard something that needed a correction, and I thought about it. And today, I'll make a gentle correction. There is a farm in South Burlington that are wonderful berry producers, and they make a value-added product called Sisters of Anarchy ice cream. And it's a wonderful product. But the member from South Burlington incorrectly referred to them as ice cream farmers. And I do not know of any ice cream farmers. So with that, I make the correction. Thank you.
Member, will the House please come to order? Member from South Burlington.
Madam Speaker, I thank my friends from the Agriculture Committee. This is not the first time I've heard of this egregious error. Who knew that cones didn't grow on trees and creamies didn't come right out of the udders of cows? I mean, I am from South Burlington. We do have a farm. And I thank you for having that correction on the record. Thank you.
Member from West Rutland.
Thank you, Madam Speaker. Madam Speaker, did you know that there is a Vermont State Barbecue Championship? I'll bet you didn't. This is going to be the first year that it's going to happen. It's so proclaimed by the governor. On June 21st and 22nd at the Rutland State Fairgrounds, the barbecue championship is going to happen. There's it's the big boys as far as barbecue in the state of Vermont. A lot of them are going to be there. There's people that are going to be bringing in their barbecue equipment from as far as Texas and Canada, and it's all sanctioned in a qualifier for the Jack Daniels National Championship. So I hope everybody can make it down.
Are there any further announcements? Seeing none. Oh, member from Shelburne.
I just want to also correct, Sisters of Anarchy is not in South Burlington. It's in Shelburne.
Okay. Are there any further announcements, members? Seeing none, member from Poultney, can you please offer us a motion to adjourn until Friday, May 30th at 9:30 a.m.?
Madam Speaker, I make a motion this body stand in adjournment until Friday, May 30th, 2025 at 9:30 a.m.
You have heard the motion. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and this body stands